telemedicine allows us much more access to patients so that, let's say, you're busy or you're traveling and you can't come in to see your doctor, you can still check in about how you're taking your HIV medicines, or if you have any side effects with your medicines, or if you have any questions. So the kind of game changer for telemedicine and having a chronic disease like HIV is that it gives you more access to your provider so that you can get the help and the guidance that you may need along the way. If you're someone who's taking HIV medications, we often want to know what your side effects are, and we often want to just hear about how you're doing taking it. So we can have those conversations about side effects and adherence through a televisit in a way that often helps us to make decisions about the medications that we keep you on or we change you to. We can also check in about other things that are happening. So oftentimes when we have a televisit and the patient's having a hard time, we can get you connected in with mental health much faster than if we have to wait for an appointment and then kind of make that connection. One of the things that I advise, whether it's a telemedicine visit or not, is to write down what it is you want to talk about. But it's really important that you tell me if there's something that you want to make sure that we focus on. Because we're not in person, I won't be able to do things like check your blood pressure or check your weights. And so if you have a blood pressure machine at home, or if you think you're feverish and you have a thermometer, or if you have a scale, any of that objective data is helpful to be able to provide to your doctor. And then the other thing that sometimes we'll ask you to do is if you, let's say, had a rash, and the rash has kind of, gone away, if you have any pictures of it or any kind of documentation of it, you can go ahead and share that with us as well. And HIV is one of those diseases where you want to stay super connected to your clinician team over the course of your life. We prefer to see you in clinic because having that patient-doctor connection in person is always really great, but telemedicine allows us that access that will really fit into a patient's life and will make sure that we don't miss any of the important things that we need to do for you as we take care of your HIV.